We're going to be talking to you a little bit about our internal medicine practice we have here over at the Cathcart Center. We're going to focus on kind of some differences between family and internal medicine, because I know that's a question we get a lot from our patients, so we want to have some clarification, and then there'll be time at the end of the program for you to ask us specific questions you might have. So throughout the presentation, if you have questions, just jot them down and we'll be happy to address them at the end, okay? So currently, internal medicine is focused on adult medicine. Now, what does that mean? Anyone ages 18 and above, all the way up to the elderly, is who we focus our care on, okay? So at our practice, we currently have 3 providers, Dr. Anderson, myself, and Nancy. We all focus on internal medicine and taking care of our adult patients. So just a little bit of background about myself. I'm actually a Wyoming gal, born and raised. I was raised in Cheyenne. My family still lives there. And I have a lot of family members who actually reside throughout the state. So pretty happy to be back in Wyoming from California. I did all my undergraduate training at the University of Wyoming, go Cowboys. And I did my Doctor of Osteopathic Medicine degree out in California. I studied at Western University, that's in Pomona, California, a little bit east from LA, if you want kind of a reference point. I completed my training, my internal medicine residency at Arrowhead Regional Medical Center, which is actually the county hospital of San Bernardino. There I was practiced for 3 years, and my 3rd year was spent also as the chief resident. My experience, I did spend a year after my training working for Kaiser as a hospitalist until we decided to come back to Wyoming, where I've established a practice here at West Park, September of last year. Okay, so a little bit about osteopathic medicine versus allopathic medicine. I get this question a lot. We actually have pretty similar, and in your packets, I believe in the back.
It's the first page.
Is it the first page? Mm-hmm. You'll actually have kind of a little bit of overview for you to look at. We got it off the American Osteopathic website, and it actually gives you some bullet points on what's the difference, what are we similar. But I am a physician. We receive all the same training as MDs, with just a little bit extra. We do spend extra time focusing on osteopathic manipulative medicine, where we actually learn how to focus on the body as a whole and learn how structure and function work together. Meaning our bodies have the innate ability to heal themselves, and we as osteopathic physicians like to utilize that in our practice, okay? We take the same board exams, we go through the same training, we just get that little extra to try to learn how to treat the person as a whole, not just as individual parts, okay? Got it?
And I'm Nancy Winkler, and a lot of you, I see some familiar faces from last month. I'm a nurse practitioner, and I also am a Wyoming person, born and raised in Wyoming. My family's all still here. I have been employed by West Park Hospital for 25 years now. 24 of those years were as an RN, started out acute care, did some OB, then I did wound care for the last 20 years. I am certified in wounds, ostomy, and continence. I became board certified as a family nurse practitioner last February, or in April, I guess. I graduated in February, got certified in April, and started in July at West Park Hospital Internal Medicine Clinic. And just a kind of an overcap of what a nurse practitioner is. A nurse practitioner has an advanced degree. We blend the nursing model of training and expertise together with clinical training so that we can diagnose and treat health conditions. We work in a variety of settings. We deal with acute and chronic illnesses. And we do a lot of wellness and health maintenance practice as well.
So here we're kind of going to focus the meat of our presentation on internal medicine versus family practice. Both providers are considered primary care providers. The difference being internal medicine, like I said before, focuses on adult medicine 18 years and above to advanced age. We classically deal with a little bit more complex cases because a lot of our patients have numerous medical problems and we treat them simultaneously. Internal medicine is the route a lot of the specialists take. So cardiology, rheumatology, hematology, endocrinology, gastroenterology, all of those specialists are first trained in internal medicine before they pursue their specialty training. So they have to complete 3 years of internal medicine training before they go into their specialty. Family practice is also a general practitioner, but they're trained in treating people from birth all the way to advanced age. So with our training, we are solely focused on treating the adult patient. Family practice, they spend the portion of their time focusing on pediatrics and OB. We provide, we kind of apply scientific knowledge and clinical expertise to diagnose and treat numerous problems. We are very compassionate about the care of our adult patients, and because of that, we really like to focus on both preventative medicine and also treating all the acute problems. So, like Nancy mentioned before, we focus on both chronic conditions as well as acute conditions. And based on that, we help our patients get to other providers as well. So we provide specialty referrals to people like surgeons, urologists, more specialty providers depending on what our patients need. Okay.
So just a few of the acute problems, there's probably more than we even have listed, but some of the acute problems that we see often are upper respiratory infections, your cold symptoms, urinary tract infections, skin infections, cellulitis, skin lesions, that type of problem, and medication reactions. Those are a few of the acute problems. Your more chronic problems, we deal with diabetes, heart disease, your congestive heart failure, hypertension, high blood pressure. Hyperlipidemia is your high cholesterol levels. Thyroid disease, lung disease, such as COPD, emphysema. We deal with people with chronic or obstructive sleep apnea and sleep disturbances, migraines, other neurological conditions, chronic kidney disease, and GERD, which is the acid reflux or abdominal problems. So we kind of are focusing today too on what we would like to see from you guys as patients when you come to see us, okay? We want you guys to know your problems. We want you to know your medications, your allergies, and we want you to know signs and symptoms to report to us about these problems.
So we actually took the liberty of making you guys some cheat sheet forms that you can use in your medical care. So sir, do you mind if I borrow yours real fast? So if you actually look in the packets that we provided you, we actually made some forms that would be helpful in kind of organizing your medical problems in your care, okay? So if we go to the medical history form, if everyone can see.
It's up here too, Courtney.
Okay, is it up there?
Yep.
Okay, perfect. At the top you would put your name, date of birth, and who your primary care provider is, because this is not only going to be when you come and see me or Nancy, but also when we go and send you to other providers, this is going to be something you can take with you, and that's way your medical history is consistent throughout all your providers, okay? So medical conditions. This is a place where you would put your diabetes, your high blood pressure, any sort of lung disease you might have, and you can list it, okay? Some people like to put the dates when they first were diagnosed or how long they've had it. That way their provider knows how long things have been going on for. Down at the bottom, we have your surgical history. This is very important. We like to know, have you had a back surgery, a thyroid surgery, any sort of surgery that might be pertinent to the medical conditions you have currently. And then again, a date is often wanted to be put down so we can kind of know the time frame of everything that's been going on. Okay, what's next?
Health maintenance.
Okay, so we also created a health maintenance section. Any of my patients here know I'm a big believer in health maintenance and always of pushing the mammograms, the colonoscopies, your immunizations, because it's really important to keeping your health at a stable state. So here, this is the gentleman's health maintenance form. I don't believe it's in this packet, but we will have them for you at a later date. But we want to know, when was your last colonoscopy? When was it completed and what was the result? Was it normal? If you can't recall, who did your colonoscopy so we can get those results from that provider. Again, prostate level. We're interested in a men's prostate health to make sure you're up to date with the current recommended screening guidelines. Immunizations, these are very important, especially as we get a little bit older. We want to know if you're up to date with your flu shots, your pneumonia shots, which we do have 2, as well as the shingles vaccine and your tetanus vaccine, okay?
That's the female one.
And this is just the female version of the health maintenance form, because as females, we get a little bit more extra focus on our health maintenance. Again, colonoscopy, but this also includes the mammogram. All your well woman maintenance, not only does that include your pap smears, but your pelvic exams. Because your pap smears, the guidelines are a little bit different on how often you need them. Your pelvic exams usually should be a routine yearly thing. We also add the bone density scan, because after we get a certain age, we want to make sure our bones are nice and strong. So we want to know the last date you had that as well. Again, your immunizations at the bottom.
Okay, then we come to our medication form. And this is probably one of the, this is very important, because this is constantly as a form that needs to be updated as medications are changed, as people add supplements or are taken off medications or supplements. So you can see on here we have prescription medications, over-the-counter medications, and this includes not just over-the-counter but also your holistic supplements from like a health food store. Okay? We want to know dosage, we want to know how often you're taking it, and we want to know what you're taking it for. So many people come into our office and they say, well, I'm taking this medicine, and this one's a little pink one, but I really don't have any idea what I'm taking it for. So it's real important that you know why you're taking it and the dosage and the frequency, okay? And over-the-counter medicines, so many people do not feel that these are really drugs per se, that they're just a supplement. Over-the-counter and holistic supplements are just as important as your prescription drugs, because they still can have interactions with everything else that you're taking, okay? It's just that prescription drugs are FDA approved and they have been tested and have known side effects. The over-the-counter medications and the holistic ones are not always FDA approved, and they've not had that testing, so there is not the known side effects. And they are not, just because they're a natural supplement or a holistic supplement does not make them any safer or more natural than your prescription drugs. Okay, that's, I think, a big factor that we hear all the time and have a lot of questions in our office about. So real important just to know everything you're on and your allergies and reactions, okay? There's a difference in allergies with actually having a reaction that is life-threatening versus I just don't tolerate the medicine. So that's important to know too. So once again, there's the prescribed drugs from a provider, there's the over-the-counter, and your vitamins and holistic supplements. And they're all considered drugs. And that just kind of reiterates what I said about the FDA approval and all the side effects. And once again, what are you taking it for? Okay, then we want to talk about polypharmacy. This is a very common phenomenon that we see. Polypharmacy, if you're over 65 years old, taking more than 4 pills a day is considered polypharmacy. And I don't know, and that includes like 70 to 90% of people over 65 take more than 4 pills a day. Okay? And this really, polypharmacy has a big effect on taking multiple medications for multiple health conditions and all the effects, okay? The problem that we see is that really, if people are seeing more than one provider, then there's not the updated medication list. We don't always know everything that you're taking. Okay. Anything else you want to add there?
I think this is a big thing as we do get older. Like Nancy said, we're often seeing numerous providers because that's what our medical problems are requiring us to do. And that's why we really stress the importance on any time you establish with a new provider, you bring in all your medication bottles, okay? That's a great way to get started because we're able to actually look at the bottle, see the medication, see the dose and how often you're taking it. And we often see all the different pills from the numerous providers. So as a primary care practitioner, we're kind of going to be your go-to person on keeping everything straight and organized for you. So anytime you do see another provider and they might put you on a medication for a short period of time, we still want to know. Because of the complications of people on numerous medications, they can also have interactions, and as the primary care provider, we want to help minimize those interactions. So it's very important that when you are put on a new medication, you update your list and also tell your primary care provider. As we get older, we often become more sensitive to medications that we tolerated in the past. So a lot of times I'll sit down with my new patients and we'll go one by one, see what we can eliminate, see what we can decrease, because oftentimes the goals of our health change as we get older. We don't need to be as aggressive as we were when we're 40 years old. So over time, we're able to make those adjustments and hopefully to help prevent polypharmacy and these interactions from occurring.
Another side note too, with say you're going to a health food store because you're having trouble sleeping, you know, if you go in there and you say, I need a supplement to help me sleep, well, they're not going to ask you what all your other medications are. I mean, they might, but probably not, and they're not going to have any kind of reconciliation type of service to see if what they're going to give you would interact, okay? They're in the business to sell you a product, and so it's real important that that reconciliation does occur. And every time you come into our office, we are required to do a medication reconciliation, and that's another reason that it's so important that we know every medication that you're on so that we can evaluate that. Okay, so I guess our last slide just kind of says, regardless of your age, it's important to your health that you develop a relationship with your provider. You know, this is a team effort, and you are the biggest part of the team, and so we need all the input and all the information and everything that you can provide to us so that we can better take care of you.